Hi, my name is Nike. I'm going to be your nurse this afternoon, and I'm here today to perform IV insertion. How are you doing? Is it a good time for you? Yeah. Okay, right now I'm going to, can you please state your name and your date of birth? Okay, the name matches the tag. So I am here this afternoon by the doctors, according to the doctor's order from the physician, to start an IV. Do you know what an IV is? No? Okay. An IV, I will perform an IV, and that is, I will be putting a catheter, I will be inserting a catheter into your vein to administer medication, so that every time we have to come and administer medication, we won't have to be poking you with the needle all the time. Once the IV is in your vein, then we can just come in there and insert the medication or put the medication we want to put. Okay, right now I'm going to go and wash my hand, and I'm going to don my glove. Do you have any allergies? No allergies. Okay, I'm going to provide privacy. So before we start this procedure, I need some materials. I need to get my materials set up, and we're going to be needing an NGO catheter for this procedure. We need a tourniquet for this procedure. Also, we're going to be needing the target arm, and I'm going to be using this for my target arm. And we also need a sealing lock. Also, we're going to be needing alcohol wipes. I have some alcohol wipes right here. And also, we need a 10 cc normal sealing lock. Also, we need an IV label. So right now, after I've performed my hand hygiene and I've prepared my equipment that I need, I'm going to be unwrapping the NGO catheter, the one we have right here. This is already opened, so it is opened now, and I'm going to just put it back in here so as to make it not being exposed to pathogens. So I'm going to set this aside. Because the needle is already moved away from the base, and I'm returning it to its original position. I already have my kit opened, so I have some tape right here that I'm going to be using for this procedure to secure the IV in place. Also, I have my tourniquet within reach right here. And the next thing I want to do, I'm going to be exposing my target arm and get it ready. What I'm trying to do right now is just setting up everything that I will be needing. Also, I have set that within reach. I'm going to expel a small amount of hair from the normal sealing because we don't want any bubbles inside that. So I set that aside. I set that aside because I'm going to instill that normal sealing into the sealing lock, and I will leave the syringe attached to it. The next thing I want to do here, I'll prepare the patient. I'm going to be getting my tourniquet. I have a towel already under the arm of the patient, and I'm going to place the tourniquet 6 to 8 inches above the anticipated venipuncture site right here. Can you please clench your fist, open and clench your fist for me? The tourniquet may feel tight a little bit, so keep clenching your fist and keep opening them for me. This, I'm trying to make sure the veins are dilated. Then I'm going to gently tap the back of my patient's arm lightly to look for the vein that we're going to be using. Right now, I'm using the patient's non-dominant hand. I want to remove this tourniquet because I already found the space where I'm going to be using, and because I don't want it to be there for more than 1 minute. So, having given it a little bit of space, I'm going to tie the tourniquet back 6 to 8 inches above the anticipated venipuncture site. I already located the vein I'm going to be using. I have my alcohol wipes right here. So I'm going to wipe, cleaning from the center of the venipuncture site in a circular motion, and I will be moving it away from the center outward, so that site, that spot is not contaminated. I'm going to allow it to air dry, and with my non-dominant hand, I'm going to pull the skin taut like I'm doing right now below the site. Are you okay? So right now, the next thing I want to do, I'm going to be holding the NGO catheter at a 10 to 15 degree angle with the needle bevel up. And I will insert the catheter into the skin, just like this. I will insert the catheter into the skin. And into the vein. And once I see the flow of blood, I will lower the syringe. I'm going to be lowering the syringe. Okay, this has to stay in place. Okay, I will lower the syringe angle. I will advance it slightly to ensure the needle and the catheter are in the vein. Once that has happened, I will stop. Then I will advance only over the needle catheter with the index finger until the orb is at the venipuncture site and until it's made contact with the patient's skin. Then, since the blood is flowing, I'm going to release the tourniquet. And I will also carefully remove the needle and engage the needle safety device. While holding pressure, I'm going to be holding pressure on the vein using my non-dominant hand, my thumb actually, to prevent blood flow. The next thing I want to do here is I'm going to attach the saline lock. I'm going to be attaching the saline lock to the hub of the catheter. like this. I want to make sure I get it secured in. After attaching the sealing lock, I will release the thumb. I will release the pressure on the thumb. Then I'm going to flash the catheter with normal sealing to ensure position, patency, and flow. Okay, right now what I'm doing right now, I'm flashing the catheter with normal sealing to ensure for position, patency, and flow. Then I will I'm removing the normal sealing flash syringe. I'm going to put this back in place. And I'm going to tape. Hopefully this tape here is going to do the magic. I'm going to tape this across it to secure it in place. The tape is across the insertion site. I will loop the saline tubing and I will secure it with tape. Okay. Okay, my tape is getting messed up. Okay. Okay, we want to put a tape over it to secure it in place, just like this. Just like this. Okay. The next thing I want to do, I'm going to get my pen and label the date that this was put, the time of insertion, the type and gauge of the catheter, and my initial. I'm going to be writing them over the tape. Also, I will clamp the saline lock. Then, after this procedure, I want to discard the tourniquet and any sharps into the sharp containers. I'm going to be removing my gloves and I will perform hand hygiene. And that brings me to the end of this procedure. Thank you for watching.